So we're going to talk about today Chondromalacia Patellae. So what it is, just big medical terms for knee pain. So it's a type of knee pain that we tend to see in the office. It's pretty common to other types of knee pain, only because it kind of originates, the mode of onset is pretty similar to other types. So what it is truly is the cartilage that's underneath the kneecap or the patella, where it kind of originates, sits on top of that knee joint itself, just starts to kind of deteriorate. You start to see a little bit of arthritis in that area. So you're going to kind of notice as the imbalance of the muscles are kind of pulling on that patella a little differently, or what we call tracking. As long as the tracking should kind of go straight right down the middle of the knee itself. But sometimes you might see it kind of shift side to side. It's going to kind of throw off the biomechanics of that, and then that might put a little extra stress on some of that cartilage. So then you're going to start to see that cartilage tear down, and then that's where you're going to start to see arthritis build up. So that's kind of what we're looking at with this condition. Now, majority of the time when patients come into their office, they're going to be kind of experiencing joint locking, some kind of popping or cracking noise. You may also notice some kind of like a sensation where you feel like the knee's kind of giving out. We also see sometimes some swelling. So that's the thing, is when you irritate this cartilage around this kneecap, you're going to see a little bit of swelling and fluid kind of build up. So we're also going to kind of notice that kind of up the chain. So you're going to see the quad muscles, you're going to see the hips, you're going to see the pelvis. All that's going to be kind of thrown off a little bit. You're going to see like that muscular imbalance, because when those four quad muscles are not working properly, you're going to kind of see that patella start to track side to side. All right, so typically in our office, how we're going to manage this condition. One of the really big opportunities we have in the office is to kind of change lifestyle. We have to modify what we're doing day to day. This condition is very common in people that are fairly active. People are running up and down stairs, if they're running outside, jumping, squatting, anything that's going to put a lot of stress on the knee, you're going to see that. So we have to be able to modify some of those day-to-day activities to see if we can reduce some of the stress put on this area. And then once we get kind of out of pain, we get away from that pain response we're going to see, then we start to incorporate, exercises and strengthening. We're going to throw in kind of the whole toolbox we have here in the office. You're going to see the chiropractic adjustments. You're going to see some soft tissue work. You're going to see maybe some dry needling of the area. And then at the end, we kind of just encompass it and just tie it all together with strength training. We have to make sure that we balance out all of those muscle groups, and just make sure that there's no excess stress being put on the knee. Now, that cartilage will maybe never regenerate, and in some cases, if it gets to a point, maybe surgical is always an option. But if we can catch it early enough and conservatively treat it, then we can try our best to kind of manage this and improve lifestyle and quality of life. Perfect. So if you know someone that might have some form of a knee pain and you want to get it checked out, you want us to kind of take a look at it, kind of run you through some of the tests that we might run for this condition, we'd be happy to help. Our office is a very good triage option for, from these small, middling injuries. So give our office a call at 513-463-3011, and we are happy to help. Talk to you soon.